Awesome. Cool. Hi, everyone. Thank you for joining us for our final event in 2020. I'm amazed how quickly we pulled this off. So thank you all who made this happen. And yeah, today's event, as you know, is about inclusive user research with a focus on accessibility. And if you want to tweet about us, we'd love that. Our Twitter handle is researchthing, and you can use one of these hashtags, which is inclusive research or A11Y or both. Also, a shout out to Rick, who is going to be helping us with the tweeting today, as he has done for many other events. So if you want him to give you a retweet or something, he'll be managing our Twitter account today. And I'm really excited to also just tell you a little bit about our supporters and sponsors. So a big shout out to Ben from Zebra People and Zebra People in general, who have been sponsoring our meetup and helping us through these events. So yeah, that's really great. And they're a really friendly bunch of people. So they have a lot of roles open right now. They're a specialist digital recruitment agency, and they have a lot of experience placing user researchers. So they have some freelance as well as permanent roles open. So reach out to Ben. And also, they're really fun to chat with. So if you just want to know about the market, you can also just have a casual chat with them. So I'll leave you to do that. And then some more updates. We have UXPA UK who are supporting us. We are lucky to have their help because then we can do these Zoom events. We don't have access to Zoom on our own. They have a lot of upcoming things that you might want to get involved. So for example, there's the leadership event. They're looking for speakers for this, which might happen in Jan. They're also looking for mentors. For those who don't know, UXPA UK has a mentoring scheme which helps a lot of people from different stages in UX. So if you're looking to mentor someone, they need you. And they also have some committee positions open. You can go to their website. You can just find this online yourself in case you can't see the full link. And it closes on Friday. So if you want to apply, reach out to them soon. Those are the main things about the sponsors. We have 2 talks today. I'm just going to bring this up. Like the 2 talks we have today, we have Tim, who is on call. He is from Hi Mom Said Dad, which is a voice agency and a creative agency. I hope I'm explaining that right. Tim is going to tell you a bit more about his experience he's also part of the board of Wayfinder that you might know. So he'll be talking about his experience generally with working with accessibility and doing research, including people with different accessibility needs. And then we have Humanly. They're also a studio, and we have Jenni and Ali, and they'll be doing a talk about some research that they did and co-creation that they did with people with learning disabilities. I'll let them introduce their talk a bit more. I don't think there was anything else I wanted to say. Anya, do you want to jump in and say anything?
Yeah, just if you can all put your questions in the Q&A functionality so that we don't have to monitor the chat and the Q&A. So do me a favor and keep it simple and put your question in the Q&A section. Thank you.
Cool. I think that was it. So I'm going to now hand off to Tim.
Okay, great. Shall I share my screen now?
Yep, that would be great.
Great, cool. Okay, well, hello everyone. Thanks for joining us on this Christmas evening. I know it's probably been all day of Zoom calls already for everybody here. Certainly has been for me, but hopefully this is the last of the day and we can wind down with some fun user experience stories. And I did actually want to keep it quite fun because it's the end of the day, and I've always considered user experience and design, a hobby that I'm just very, very fortunate enough that in this world, you can turn that hobby into a job and get paid for it, which is remarkable. So here I am. I am the design director and managing partner at a company called Hi Mum Said Dad. Thank you, Sweta, for the introduction. We are a digital product innovation studio, we do a lot of work in voice and lots of emerging technologies specifically for disrupted industries. So we're well versed in tackling user experience challenges with new technologies in disrupted spaces where it's incredibly challenging. And so my talk is going to be a lot about how people with disabilities have been forgotten in user experience challenges within the automotive industry. That's where the majority of my experience in the last 5 or 10 years has been, is in the auto industry, and how they're going from automotive vehicles to autonomous vehicles, and all of the interesting user experience challenges that come with that. So I also work on the board for a company called Wayfinder. This is a Google-funded, not-for-profit charity that helps the vision impaired and blind people navigate indoor spaces independently. So one example of that is on the London Underground, the current way in which a particularly severe vision impairment is treated is that the person needs to ring ahead to the station and have someone, a TfL member of staff, meet them at the station entrance and physically walk them down to the platform, where they'll get on their train and meet another TfL member at the other end, and they will walk them in the reverse to the exit. So, you know, it's very unindependent, and it's not discreet, and it's not the best experience for people with a vision impairment. So Wayfinder is an open sourced wayfinding system for the blind. Basically uses Bluetooth beacons within the station and communicates to inner ear equipment, turn-by-turn navigation on a pedestrian level with obstacle, collision, and so on, to help people get to their train independently. And now it's a UN recognized standard, an open source standard that any municipal building in the world is able to use and follow. So that's a huge achievement, very, very proud of that. And a lot of research went into how you create user experiences for people who can't see those visual designs, and often, you know, holding a dog or a stick, can't interact with a mobile device either. So very, very challenging, but incredibly rewarding. And I can give you some insights about vision impairment accessibility later on in my talk. But let me start with how I got into this whole thing. I've always been absolutely fascinated with how humans interact with things. I'm less interested in how humans interact with other humans, to be quite honest. I'm much more interested in, you know, why do you put in a lock into a keyhole, and why do you hold a cup in the way you do, and why do you drive a car in the way you do, and how are all these human and machine interactions designed? It's been a huge fascination to me, and also a bit of a bugbear. So in my life, walking around, I can't help but see user experience problems and poor design decisions, and it just really annoys me. And it's a curse because it's daily. You know, every day I'm seeing something that I thought no thought has gone into that design whatsoever. If only they considered this insight from day one, they would have created a much better experience. And one example is whenever you enter a building, you're confronted with this, a pull and a push sign, and both doors have a handle. The only reason you would need a handle is to pull on something. And yet I find myself, doesn't matter, you know, 50-50 chance I could get it right, 50-50 chance I will pull the right handle. Whenever I do, I always push on the pull handle or pull on the push handle. And it always annoys me that that's very, very common in every building. There's this fundamental user experience problem. And this is the solution. You have a pull handle for a pull door, and you have a push plate for a push door. And that's how it should have been designed. And it very rarely is. And that's just a good example of everyday user experience design that hasn't been considered from a human level. When I mean human level, I mean this concept of affordance, where a interactive element should afford you information as to how you interact with it. So a handle is for pulling and a plate is for pushing. You might see in digital design that a button will have a kind of a drop shadow or depth, and that's just to give you that affordance that this is a thing to be pressed. And another example is more on the emotional design of things. This is one of my favorite analogies. If you walk down a high street, what you have is 10 shops with 10 shop owners, all responsible for each of their own shop fronts. And you can see on this example, someone's just gone onto Microsoft Word, typed in their name, chosen a few fonts, got it printed out, think it looks beautiful. And then actually, when you put all those shops fronts together in a row, like in a high street, it's just a mess and fighting for your attention and communication overload, cognitive overload. And it's such a poor experience. And it's something we have to deal with on a day-to-day basis, just walking through town. But there's this great example in Leighton. There's an artist called Walla Walla, I think her name is. And she had this same observation and the same problem with walking down the high street. And so what she was commissioned by the one of the London councils. I'm not sure where Leighton is, maybe it's Stratford or somewhere, or Tower Hamlets. And what she did is she actually kind of embraced and celebrated the ununiformity and the strange lines and juxtaposed colors and so on. And she actually bled that out of the shops into the rest of the buildings. And actually what it's done is it's created kind of order in the chaos, and it's made it a consistent and concise and pleasant experience. And so I thought that was really fascinating. Two examples there of kind of a functional inaccessibility and an emotional inaccessibility solved in real world examples there. So for me, accessibility is always about practical and emotional accessibility. So I think when people hear about accessible design, in digital, they might think, is the contrast high enough for people, colorblind people to interpret the information, or in say industrial design, can wheelchair users access the service? And for me that's kind of 100-year-old understanding that we have people understanding that there's practical accessibility issues. One thing that's not spoken about enough, if you ask me, is this emotional accessibility. I'll give you an example of what I mean between the two in one piece of design. So this is the Route Master London bus, and the way in which a wheelchair user will board this vehicle is different to how able-bodied people will board the vehicle. So what will happen is the bus will arrive at its stop, and its front doors will open, the doors that you are near the driver, and people will wait there, and they will board the bus, walk past the driver, scan their Oyster card, maybe say hello. But for wheelchair users, they don't do that same egress, what we call egress, when you access or enter a vehicle. What happens in that case is hopefully the driver has spotted it as a wheelchair user, and they don't always do that. They have indeed spotted it as a wheelchair user, so they will enable the ramp. And it's not a simple affair. It's the suspension of the vehicle lowers, the doors at the back open, there's kind of an alert sound being made, caution sound, and then the ramp is extended onto the pavement, and then the wheelchair user can access the vehicle. So practically speaking, that's accessible because the wheelchair user was indeed physically able to board the vehicle. From an emotional accessibility point of view, it's incredibly broken. First of all, there's segregation between able-bodied people and wheelchair users. Those two people are treated differently. You enter the vehicle differently if you're a wheelchair user. So discrimination is a big word, a hard word, and I wouldn't go as far to say it's deliberately discriminatory, but it's somewhat, it is segregating, and it's not discrete. And for some wheelchair users, it can be incredibly uncomfortable because there's such a fuss made of this, onboarding experience for wheelchair users. Now, I can imagine in the engineering room when they were all thinking of designing this bus. I mean, this is a made-up thought in my head, so this isn't necessarily how it happened, but I can kind of imagine with the industrial engineers that they're going, we've solved the wheelchair issue. This is what we'll do. And they haven't actually thought about these emotional accessibility issues. All they really had to do is make sure that this ramp was at the same entrance as at the front of the bus as everybody else boards. And the wheelchair user could have accessed the vehicle just like everybody else. And that would have been a good piece of practical and emotional accessible design. So this is why I call out that practical accessibility is starting to become the norm, which is fantastic. but we're still way behind on the emotional aspects of things. Even like mental health and well-being is still somewhat of a taboo and still not very well understood and accepted. And I think this applies also to accessibility design. So my expertise over the last few years is about championing both. It's practical and emotional design, and it's not just for wheelchair users, and it's not just for people with a vision impairment, but it's, you know, it's for single mothers, it's for people with autism, it's for people who suffer from motion sickness or anxieties. There's a huge plethora of user needs that go beyond, you know, the visible. There's, you know, not all disabilities are visible, and not all human needs are visible, and we all have different human needs. So my career has been about working with the automotive companies to make sure that their new products are accessible from an emotional and practical standpoint. So I'll just give you a few examples of my some examples in my career of some wins and some interesting observations. So this, for the typography nerds out there, this is one of my favorite slides. So there's 3 fonts here: Helvetica, Arial, and a grotesque font. And so Arial and Helvetica are what are known as humanist fonts. A humanist font is a font that carries certain human handwriting qualities. So if you can imagine early handwriting with calligraphy, there's flicks at the end of descenders and ascenders, and there's a stroke width variance depending on the angle of the calligraphy of the pen. So humanist fonts carry human-like handwritten qualities, and grotesque fonts don't. They're very uniform, often equal in width, and so on. And when it comes to automotive design, one of the font types is better than the other. Humanist fonts can be read quicker than grotesque fonts. So any font that's used in the in-car vehicle, if it's written in a humanist font, there's a fraction of a second saved from a cognitive level because it was a humanist font and not because it instead of a grotesque font. So we did an experiment with the MIT where we took we redesigned the in-car dash and we changed all the typography to a humanist font, and they noticed that reaction times to a stopping procedure was improved by, you know, a fraction of a second. But that fraction of a second at 70 miles per hour was the difference of the difference in about 12 feet of a stopping distance. So they were able to respond quick enough by a fraction of a second, but that resulted physically in about stopping about 12 feet shorter than the other font. And that's the difference of running over someone or not. And so that's the level of detail that goes into automotive design. It has to be that, it's that detailed, and it has to be tested to that degree. So incredibly, so I think the automotive industry gets a bad rap. And there's a number of issues around that, around kind of build and tech legacy and tech cycles, build cycles. But actually things like what fonts to use on our screens is tested to that degree, and it's very rigorous. And now, so enough of in-cars. Now, I also have done a lot of work on user experience design for autonomous vehicles. In fact, I have to plug my book. I wrote the first ever book on UX design for autonomous vehicles. So you can download that for free if you just Google my name and driverless cars, it'll come up. The basic premise with the book is that the manufacturers building the cars are taking care of the car driving itself, but what's user experience gaps are left when you remove the driver. So for example, in a taxi situation, if you're in an Uber with a driven car and he's driving you home one night and a cat runs out in front of the car, he'll suddenly stop and he'll probably swear at the cat. And there's the feedback to the user, oh, he's swearing at something in the road, that's why the car stopped. Now imagine the same scenario, but you remove the driver and there's no feedback. The car just stops. In a new piece of technology in a cage going at 70 miles an hour, people panic. Why is this technology stopped? Why is it failing? It's a bit like a plane falling out of the sky. They panic. So there's a user experience gap there, and that user experience gap is feedback. So the feedback is something that you need to reintroduce into a driverless car because the driver's not there. And that's one of a million other examples. And here's another one. So we're talking about vision impairments, These are 4 autonomous vehicle concepts mind, though 1 or 2 of them might be going into production. We have an IDEO concept. I think we've got NIO from China, and we have Volkswagen from Germany, and I think that's Nissan from Japan. And the one thing that you'll notice with all, or you probably won't notice, but I'll tell you, the one thing that's consistent between them is they don't have any wing mirrors or side mirrors. Now, of course, the reason behind that is that there's no driver to look into them. There is no blind spot because there is no driver. And it also saves on cost, of course. The issue here, though, is that they haven't considered all of the user needs and all user types and all disabilities, because the vision impaired for some generations now have been using these wing mirrors, these side mirrors, to reach out for their vehicle. So they know that their Uber has arrived. They'll reach out with their hands. And what they're feeling for is not the car itself, but the wing mirrors, the side mirrors. The reason is because there was 2 pieces of tactile information that they're getting. On one hand, they're getting a curved piece of plastic, and on the left hand, they're getting a flat piece of glass. With those 2 pieces of tactile information, they know which way the car is pointing, where they are in relation to the car, therefore where the door is, and they can let themselves in. So you can imagine a driverless car where the driver can't help them in, and a driverless car with no wing mirrors, the vision impaired aren't able to board the vehicle. So that needs solving, and I'll come on to that. And so, what are we doing for time? How are we doing for time? I'm okay? 5 minutes, 10 minutes, 5 minutes?
You have 5 minutes.
5 minutes, perfect. Okay, so this is, I'm going to end the talk on a kind of a culminative few pieces of work that I've done in the last few years. So this is a concept autonomous vehicle that we designed for a car company who I can't mention. But the interesting experiment here was that everything on the car had to be designed from a user-centered perspective and from an accessibility perspective. So it wasn't about speed or how clever it was or how cool it looked or how cheap or expensive it was. Every inch of this vehicle was designed with a piece of user research that's gone into it. So the first one, you'll notice that there's no wing mirrors, or is there? There's a remnant of a wing mirror left here. It's what we call the nubbin. Basically, it's a tiny piece of material that retains those 2 pieces of tactile information I mentioned earlier. So you still have the curved plastic side, and you still have the flat plastic side. So it retains those 2 pieces of tactile information that the vision impaired need to orientate themselves around the vehicle and therefore let themselves in. So that remains, but what we have done is we've kept the kind of cost saving benefits and the drag benefits and the aesthetic benefits. So that solves that issue. There's also the grille. So I think everybody knows that all cars have a face, and Ferraris will look mean and powerful, and Kias would look friendly and cute and family orientated. Now, when it comes to autonomous vehicles, there's a fine line that they need to draw. One is, don't be so cute that you get bullied by drivers. So there's lots of examples of the Google Firefly car, you know, the famous Google driverless car. It's so cute looking, it looks like a panda, that people wouldn't let it go at intersections, they wouldn't give way to it, and they would just bully it basically, and it wouldn't get any passenger anywhere because it was just stuck at the crossroads forever. Now, on the other hand, you don't want like an autonomous Humvee that is so scary that no cyclist or passenger would go anywhere near it. So what you need to, it needs to be approachable, but it needs to command respect. And when it comes to the interior of the vehicle, it's very, very important. So these vehicles will be on the roads all day long, and we don't want them to be parked up, not being used. They need to be used all the time. And so what we've decided to do is create a interior that is dynamic and can change throughout the demand of the day. So say on the weekend, on the left, you have a seat configuration, 6 people can board. Seat configuration is 2 benches of 3 facing each other. So if you can imagine if 6 people board this, there'll be 2 groups of 3 facing each other, and it's conducive to a conversational atmosphere. So that would be a family on the weekend, for example. Now, come Monday morning, when that vehicle's all about commuting into work, and you have 6 grumpy commuters, strangers who don't want to look each other in the eye, what happens then is that bench of 6 comes into the middle and forms an island. And these 6 people sit in the middle, and they face outwards. And so there is no awkward eye contact, and that's much better for people with anxiety issues, people with autism, children, and so on, some vulnerable people. And so functionally it operates because it's still traveling 6 people around, and emotionally it's accessible because now strangers can board it and not feel strange. Now, just one last example of children getting sick in cars, motion sickness in cars, and that's on the increase because of kids using tablets and smartphones in the car to pacify themselves and pass the time. The problem is that their inner ear and their eye aren't correlated, so they're feeling motion but they're not seeing motion, and that's what creates motion sickness. So if you gamify the outside space so that you are interacting with the outside world, you mitigate that disparity between the two senses, and it cures or alleviates the motion sickness, but it also has that benefit of pacifying the child. This is a piece of work that was done with my colleague in the Copenhagen Institute of Interactive Design. And so when it comes to the design versus human behavior, that was kind of deliberate tension designed in there. It's my annoyances is when design is fighting against human behavior, like in those door examples, like in the high street example. Design should never fight against human behavior. It should always be, everything should be designed for human behavior and for people of all types and with all kinds of needs. So human behavior and design should be put hand in hand. And that should be both practical and emotional accessibility. That's it. I think I got there just about in time. Any time for questions?
There is time. Sorry I rushed you. Was there anything else you wanted to expand on? Because we do have a little bit of flexibility.
Yeah, so there was a comment I think I got in an email before this talk about clients' appetite to take on these accessibility. Let me stop sharing. This is annoying me. Around how easy it is to work with clients like Volkswagen and some of the other automotive companies, and what their appetite is for this emotional and practical accessibility design. And the answer is actually quite low, unfortunately. It took a lot of convincing. In fact, the way we got around that was we had to show them what the financial return on making it accessible for blind people was. So we made all kinds of strategic plays, like this is how many people with a vision impairment exist right now. You know, this is an untapped market for the auto industry. So if you get them on your autonomous vehicles, then you have a new market. But then other plays like something like 90% of people with vision impairment are over 80, which is a crazy statistic. And more people, we're living longer and longer. So we're in an aging population, especially in places like Singapore, but also in the UK. And so that market's only going to grow. So if you could be a market leader on having an autonomous vehicle that's accessible to people with a vision impairment, then you've got an advantage. And we had to play that card and convince them that way before we could go ahead and do the work, which is very fortunate. But I guess it's the realities of a commercial company such as the big auto players.
Yeah, that was really interesting, especially when it comes to like new technology, like autonomous cars. It's like, what is the problem? What problem are we solving? Like, there's so much we could do if we considered the needs of everyone, as opposed to just doing something because we can do it and then forgetting all the tactile elements that you talked about. That was really eye-opening. Thank you. I'm going to hand over to Anya so she can see if there are any questions, and also panelists, you're welcome to also ask questions.
Okay, I can start with one of the questions. So there's one question which is more general, which I will wait because I think it's a question relevant for all of you guys. So I'm just going to go for the ones that are directly for you, Tim. So the first one I have is, unfortunately, anonymous person. They say, fascinating talk. Just one thought. I would argue that with the bus and wheelchair example, the wheelchair user might worry about holding people up if they have to board the same place. What do you think about that?
Yeah, so we did quite a thorough research on that, and we found out that the waiting to be boarded was actually in the current solution is actually would be slower. So hopefully that wouldn't be an issue if they were to board at the front of the bus.
Okay, cool. I have a question from Asan, and they're saying in-car screens and software goes out of date very quickly. What work is being done to allow users to mount our phones with connected software that updates when needed? What brands are doing this? Is that something you can help us with?
That's a very good question. So there's two parties here. There's the incumbents, you know, the old OEMs, the 100-year-old Ford Motor companies, and then there's the new kids on the block, so Tesla and NIO and Byton. And I think the incumbents are having a hard time. I think originally they were trying to compete with the likes of Apple in terms of the tech fidelity in their vehicles, which was just never going to happen. But then you have Tesla come along, and they enable over-the-air updates, which is, I think, one of the first vehicles to do over-the-air updates. Over-the-air updates basically means the hardware is as is, it's stuck the same, but the software can be updated on the fly, just like on our laptops or our phones. We have updates all the time. And I think that didn't exist in cars until recently, and that's made a huge difference. So even though the hardware is stuck in your car, but the software inside it can be updated. So there's a number of companies now finally who are embracing that. So Polestar is one of Volvo's big new brands. They're the first automotive manufacturer to have Android Auto full stack in their car. It means anyone who can develop for Android with a bit of, you know, revision and training can develop products for an in-car space, which is just amazing. But then there's you know, I don't want to dismiss the incumbents too much. Mercedes have a new product out called Mbux, which is their in-car operating system. So, you know, Mac has OS and PC has Windows. Mercedes have their own OS called Mbux, and that has over-the-air updates as well. So I think over-the-air updates is the key to updating software into native technology in the vehicle. When it comes to mounting devices in the car, it's just so held back by regulation. It's not allowed. In fact, in the UK, I think they've changed it now. Your screen can't even be, if your screen is lit in your car while you're driving, you could get a ticket. It's not just talking on it, texting on it. If they see that your screen is lit, you can get a fine. That's how police will prove. So it's just a battle against the regulators, and tough one. Even Apple's iPhone has a car mode now, where if it knows you're in the car, it will just sort of go into airplane mode basically and disable the screen. So that's a tough one. I think there's lots of potential there, but it's very difficult to police and regulate.
So what about those companies that don't want to design for all? It's a question from Celine.
So what was the question?
So the question is, what arguments do those companies give you for not designing for everyone?
It's always comes down to commercial realities, I think, or you know, commercial unfortunate realities where blind people don't buy cars. So why would we? You know, it's quite short-sighted. I don't mean to, bad pun. It's quite short-sighted because, well, that's a potential market, and actually, I think that people with a vision impairment also have mobility issues, not because they can't walk or they're bound or wheelchair, anything like that. It's just because, societally speaking, it's quite difficult to access jobs and, you know, transportation and all of the things. So their mobility is restricted, and some people with vision impairment, you know, don't cope as well as others, and they are stuck to their homes and so on. And it's because their mobility is restricted because of these societal barriers. And therefore, I think autonomous vehicles is a potential game changer for people with a vision impairment. And so I think absolutely they should be considered. And I guess that's more likely to happen now that this kind of car ownership model is being challenged. Once upon a time, I think you could only really buy a car and it was parked on your driveway for 9 hours out of 10, not being used. I think people are getting wise now to things like subscription models and pay to play and so on. So now there's car rental schemes and car subscription schemes where you don't really need to own the vehicle, and car companies are looking at different monetization models such as those. So when that becomes more prevalent, especially in the city, it's going to be a great thing for people with disabilities, because they will want to make that service accessible to as many people as possible. And I think at that point, that's when it becomes very compelling to start making it accessible to people with all kinds of disabilities and other, permanent and temporary needs.
Great. So I have a couple of questions that are all around the emotional accessibility. So let me see if I can summarize, and maybe you can talk a little bit more about this. So I've got Ellie asking maybe about more examples. Steph is also interested in, practical accessibility is relatively well supported by frameworks, but where do you begin with emotional? So then, maybe you can start by starting with those questions.
Okay, so are there examples of emotional accessibility? I did have a number of these. So again, let's go with the vision impaired again. I just have a huge amount of experience in that with this particular disability. There are many other needs, but we were working with a number of vision impaired people, and they were, and we would take them on a car journey in an autonomous vehicle, and we had them hooked up to galvanic skin response monitors and eye tracking monitors, and we even were able to read their BPM based on the color changes in their forehead, all sorts of sensors to be able to detect their mood. But also we did kind of qualitative interviews afterwards. But basically it was just a matter of understanding what all their emotive needs were on a journey, and we put them through a number of scenarios. One, as I mentioned earlier, was stopping suddenly and observing how they felt when there was no feedback. And we could see from we didn't need the charts. We saw the charts skyrocket. We didn't need them. We could see on their faces they were, alarmed. And another scenario was that we were going to drive. This was a bit mean, but we said, right, the testing is over. We're going to drive you home now. And they know their way around. They can feel the turns, and they know roughly the duration from where they've just been to where their home is. And we deliberately took them in a roundabout way, and it took about 3 times more than it should have. And you could see that they were starting to panic. And what happened, all of them were reaching out. They've gotten used to this voice interface, but where they were asking how long till the next, how long till we get there, and so on. And what can I see? Why did you just stop? And there was an interface that was able to respond. And we noticed that they, on the way home, they were saying, how long till we there? How long till we're there? And we kept saying the wrong information. And eventually they started asking a different question. They started saying, what can you see on your left? And it would be, oh, the petrol station. And sometimes it'd be, no, you've gone the wrong way. You've gone the wrong way. You need to go right next. And there was just this, and there was all sorts of conversation, and the machine wasn't intelligent enough to be able to respond to everything. But the insight there was that feedback is so important to anyone with a vision impairment, and feedback. And we take it for granted because we get feedback constantly every half second because of our vision, which they don't get. And when you remove the driver, then it becomes even more important for the feedback to be important. When it comes to your question around emotional design and sorry, I forgot the second half of the question.
I think that's fine, because I think it'd be good if we move on.
Okay.
Apologies for we have loads of amazing questions, and I will try to copy them all now and forward them to Tim, and maybe you can follow Tim on Twitter, and maybe you can post some of the answers there. Is that okay, Tim?
Sounds good. Yeah, thank you for.
Perfect. I'll do that. So thank you so much for your talk. Yeah, you have loads of questions. I'll forward them.
Great.
Over to you, Sweta.
Thank you. So now I'm just going to hand over to Jenni and Ali in a bit. I think this is a good place to kind of, now that we've listened to visual impairments and autonomous vehicles and all the challenges that brings. It's really interesting to listen to the research and the examples Jenni and Ali are going to give us, and especially with learning disabilities, because I don't think it's talked about enough, and it's one of those things that could be quite invisible or hard to understand. So I'm going to let them carry on and tell us more.
Great, thank you. Yeah, we're really excited to be here. I'm Jenni, and you can see Ali as well.
Ali.
We'll introduce ourselves properly as we go along. So yeah, we're going to talk to you about a case study of one of our projects called Daybook, and share lots of wider takeaways about designing with and for people with learning disabilities. So first of all, just to say a few words about Humanly. We are an award-winning design studio based in London, and we specialise in human-centred design for social impact. And we work solely on social impact problems with a wide range of organisations, including national charities, government, international NGOs and UN agencies. So it's really broad, ranging from really kind of community-based projects to big international projects. We specialise in working with so-called vulnerable groups, and we've tackled a really wide range of social issues, including ageing, mental health. We've worked in education, we've done work with refugees, so it's been a really broad range of different projects that we've worked on. And just to say a few words about ourselves, I'm Jenni, I'm the founder and director of Humanly, and I've been working in the field of social design for about 10 years now, on a wide range of projects all over the world.
I'm Ali, I'm a social innovation consultant at Humanly. I have a very varied background, including education and special and inclusive education, and working with autistic people.
And just to quickly say, we are hiring. So if you could see yourself joining the Humanly team, please do get in touch. We're looking for a service designer, and all the information is on our Twitter and our website, and we'll share the link as well.
So the initial idea for Daybook came from the charity Voiceability, and the initial idea was to develop a digital consultation platform for people with learning disabilities. And with this in mind, Voiceability applied to the Department of Health Innovation Fund, then brought us in to lead on the research and design, plus partners for development, because they knew there was going to be a digital outcome, and impact and evaluation partners for the project. So we took a human-centred approach to the project, which meant that we took the process right back to the start, and to look at the problem rather than the solution as a starting point. Now, very quickly, just before we get into the consultation model, just to explain for anybody that's unsure about when we're talking about people with learning disabilities, the best definition, the kind of an accepted definition, is the definition that MenCap use, which is that a learning disability is a reduced intellectual ability and difficulty with everyday activities, for example, household tasks, socializing or managing money, and that would affect somebody for their whole life. So people with learning disabilities tend to take longer to learn and may need support in developing new skills, understanding complicated information and interacting with other people. So this is, we're talking about something very distinctly different from a specific learning difficulties, such as dyslexia, just sort of to clarify before we carry on. So we started by looking at the existing consultation model, which is problematic for everybody, but particularly difficult for people who have a learning disability. Because it involves direct questions, which can be problematic. It's often written or requires verbal responses. So for people with non-verbal communication who can't read and write, it's problematic. They often happen at a centralised location during the day in office hours. So if you have mobility issues or financial constraints or limited choice and control over where you go, then you will be restricted into whether you can participate. And often when consultations are specifically about involving people with learning disabilities, there's a reliance on forums such as boards, which mean that the same people are often having their voices heard for a number of years, rather than it being a broader sort of consultation. And then what this means in reality is that actually people with learning disabilities rarely get a say in the decisions that affect their lives. So this example is taken from a consultation by a local authority on respite opportunities. And actually only 15% of the respondents to this consultation had a learning disability, despite it having a direct impact on the lives of people with learning disabilities. So for this project, we worked with 17 groups of people with learning disabilities around the UK. Lots of very different groups. So for example, discos, pubs, private companies, as well as council-run services. So the way that these groups got involved was that some were local authority services in the areas that we were working in. So we were automatically linked by the local authority we were working with. For others, we reached out directly to groups ourselves, and generally we were really welcomed, and we got a very positive response, which meant that we were able to include a really wide range of people, including people with non-verbal communication, people with complex needs. The only group of people that we struggled to include or to actually be able to kind of go and involve in the process was people who had behaviour that could be seen as challenging. We have, however, been able to include people with challenging behaviour in subsequent projects. So the way we went about the research was by identifying 6 key research themes. We then designed a toolbox of activities around this. So that enabled us to explore all of these different questions with a really wide range of participants. And by having a toolbox, we never went to a research session with just one activity planned. We always had backups, because we were well aware that actually we might try one activity and it might not work with that particular group. So always necessary to have other activities ready to go, so we could just swap what we were doing really quickly if it wasn't working as we hoped. So through these activities, we were able to get really rich insights, and I'm just going to go through a couple of our key insights, but there were many more. So we learned that direct questions make people feel under pressure, and often people feel like they have to give an answer, even if that answer is what they think that the person wants to hear, rather than necessarily being representative of their lives and their feelings. There can also be a tendency to perceive a series of questions asked by a professional or in a formal setting as a test. So you need to be really careful around asking too many questions. In comparison, we found that people really like telling their stories, and that this was enjoyable, it was less stressful, and we actually got answers to all of our research questions just by letting people tell their stories, and it was also much richer. We found that show and tell was really effective, so making sure that people were able to show what they were talking about at the same time, and it meant that people were able to give us a much richer understanding of what they were doing. So for example, if we asked people about what technology they used and how, people really struggled to articulate that. But if we said, can you show us your mobile phone and what you do on it, then we were able to learn a huge amount more. We also learned that having tangible outputs was really important. And it gave people a sense of recognition and accountability. So people loved having their photos taken generally, especially if they had things that they'd created. So taking a photograph of people with the thing that they had created. And lots of people asked for copies of the photographs that we took, and some even asked if we could publish them. So another thing was really important to have a written copy of the outputs for their records. So we always made sure that we photographed what people had made and left it with them, and we never took it away. So it was a case of us taking the photographs and then getting photographs printed and taking them back actually as well, but always leaving the actual artifact that people had made with them. So these insights led us to reframe the problem, or reframe the question that we were trying to answer, to how might we enable people with learning disabilities to share their lived experiences with people in power. So we then went into co-creation. This involved coming up with some really creative methods for co-creation, so that we could genuinely involve a lot of people with a lot of different needs. We used a really wide range of methods, and some were successful and some were not. And we are happy to admit that. It was a case of trial and error and just learning as we went. So, for example, we found that using drama to talk about things that had happened in people's pasts was really effective. But trying to use drama to explore things that people hadn't experienced was not effective. It didn't work well. Whereas we asked people to create soap operas, and people absolutely loved it, and it was a really successful activity that enabled us to explore a lot of different topics. One of the difficulties we found in co-creation was that people had often had difficulty expressing negative views or negative experiences. And some of the ways that we kind of found helped with that was by using physical props. So you can see there's a big emoji cushion of a poo, and by talking about things that were poo, it also often made staff more comfortable than talking about bad things, but it meant that everyone wanted to have a go at holding the poo and talking about the bad stuff. So we found a lot of different ways to kind of enable people to talk about these things. So the co-creation process led us to focusing on the concept of a digital diary. So this built on an existing culture of paper diaries, which are used to as communication between services that people attend and people's homes. So obviously the paper diaries, a lot of people couldn't actually interact with themselves. They weren't able to access that information. So even though they were called their diary, they weren't able to read or contribute to it. It was just sort of about them. Whereas with a digital diary, the idea was that people would actually be able to take ownership of it and be able to be the person who was building that diary and communicating between different places. And this was built on by lots of different people. So we then went into prototyping, and we tried a lot of different techniques for prototyping, so to test different elements. So we used, for example, a postal kit with disposable cameras, and we left this with someone for 2 weeks, asking them to take photographs on the green camera of the good things that happened over that time, the red camera for the bad things, stamped addressed envelope, and they posted it back, and we were able to process that. And even though we'd interviewed this young man twice, we actually learnt more from those photographs than we were able to through those interviews. And we also, to test whether behaviour was upheld, we used WhatsApp as a test for a kind of WhatsApp diary, and asked people to text us on like photographs and text about their days. And we found that people actually, if they could write, the text was the preference that people would use. So we ended up creating Daybook, and there is a video of Daybook if you want to see how it works on our website. So you can go there and look at our work, and you can watch a whole video about it. But very quickly, as a kind of overview, it enables people to make diary entries that are tagged with topics, for example, work or health, and also tagged with emotions. And entries can be made using text, video, or photographs, and then they can be filtered by these features so that you can look back at memories that are, for example, about work that are good. And then with permission, anonymised entries are visible to local authorities, who can then, for example, search for posts about transport to see how people with learning disabilities in their area are experiencing transport. So Daybook was then piloted in 4 areas, really different areas, rural and urban, across the country. So it was a really kind of broad pilot. And then we won the UX UK award for Best Not-for-Profit for the research and design of Daybook. And now Jenny is going to talk you through some of the takeaways.
Great, yeah, so hopefully this has already given you some inspiration, but we've developed some takeaways that would hopefully help you conduct your own research or co-creation with people with learning disabilities. And the way that we decided to present this was around things you could think about before, during and after. So before running a session with people or an activity, the first thing to consider is the limits of your own knowledge and experience. One of the Daybook developers actually said to us that he'd never worked with such a diverse group of people all put under one umbrella. And I think that's something that's quite common. So I think if you're going to approach a project like this as a researcher or a designer and you haven't worked with people with learning disabilities before, we would recommend to involve someone with expertise in that area to help you co-design the actual approach and the activities. And that's actually how Ali and I met, given her background in working with people with learning disabilities, and then I coaxed her over to the world of human-centered design. Secondly, we would always recommend to go beyond the usual suspects. So try to recruit a wide range of participants, including people with non-verbal communication, profound and multiple learning disabilities, people who don't access any formal services, people with behaviour that can be seen as challenging. It might take a little bit longer to recruit people and set up your sessions, but there's lots of ways that you can successfully include everyone and better understand their needs. Thirdly, we would suggest not to ask people to go to unknown venues, instead keeping things as familiar as possible for people by going to their usual meeting place. And this is a picture of Ali and I at a disco. We went to quite a lot of discos for people with learning disabilities in the name of research. And then something else that we did in this project and other projects that works really well is to introduce ourselves in advance. And what we've always done is just made a short video on our phones, which works really well, just saying who we are, why we're coming and what we want to talk about. And it's even better if you could add subtitles to those. And that enables people to revisit the purpose of the visit or the session. They can think about questions and they can see and hear the people who are going to be coming and who going to be doing this activity with them. So that limits uncertainty and means you're not completely unknown when you arrive, and it maximizes people's ability to give meaningful consent to participate as well, which is really important. Next on the checklist, before you start, we would suggest to check people's communication needs and preferences rather than making any kind of assumptions. For example, this is a picture of somebody's eye gaze device, and he was a very chatty young man, and we managed to do an extensive interview with him via the device. And yeah, he was also very funny and cracked lots of jokes. So we would suggest to ask what activities participants would enjoy and would normally be doing at the time of your visit. For example, we went to some art groups and did an art activity, or we went to a drama group and we used drama. So just trying to fit in with people's routine. Next, we would suggest you to think about different activities that can make it easy for people to take part and get meaningful results. And there's lots of key points to make here, some of which Ali's already covered. So avoiding direct questions, which can make people feel really on the spot, and instead giving people opportunities to tell stories about their lives. And then, as Ali mentioned, people gave a lot of great information when we talked about really tangible things, or show and tell, or environments that we were in. So avoid kind of hypothetical scenarios. So what would you do in this situation, or think of a time you were in this situation, but instead focusing on the here and now. So if you want to ask people about their experiences of GP appointments, you might want to kind of, conduct an activity in a GP waiting room rather than asking people to imagine being in that situation. And be careful around aspirational activities or questions. And this is because everyone is limited by what they know and what they've been exposed to. So if you ask someone with a learning disability, for example, what their dream day would be or what their dream activity would be, they might just actually repeat things that they already do, because they might not have been exposed through media and other things. If they've got limited control of what they actually access, they might not have been exposed to alternatives really. So it's important to expand people's horizons if you want to do anything that's more around co-creation and imagining new things. And finally, projection onto fictional characters can work really well for difficult topics. It's less focused on them and maybe negative experiences. Last tips for planning ahead of your session. So design it to be fun and creative. If it's not fun, people will just leave the room, which is an experience I hadn't had before. So if you want people to actually stay and engage, it has to be fun, has to be really creative, and don't pack too much in to your session plan. Allow extra time and always have alternatives up your sleeves. So Ali's already mentioned our mega toolbox that we had. It's always a good idea to have different ways of doing activities, so if people get bored or they're not enjoying it, you can just swap it for something else. So then when you're actually doing your activity and you need to introduce yourself and explain why you're there and what you're trying to achieve, that can be quite difficult if you're researching something quite complex or abstract. So one technique we found useful was to create stories to explain what we were trying to do. So we created two characters called Bob and Joe, and we basically used them to explain the problem we were trying to solve and the outcomes we wanted to achieve. So we said we want less people to have an experience like Bob and more people to have an experience like Joe. And we had a simple story about each of those characters. And secondly, just making sure that people know that they don't have to join in if they don't want to, and that they can just stop the activity or leave at any time. I mean, this is true of any research, but it's really important with people with learning disabilities who might not always, have a lot of control over their day. And then thirdly, if someone in the group communicates using Makaton or British Sign Language, just make sure ahead of time that there'll be an interpreter, or bring your own interpreter if you don't know how to sign. And just be aware that even in a service where there might be staff or volunteers, don't make any assumptions that staff will know how to sign or that communication aids will be available, as this caught us out on some occasions, that actually there was someone in the session who needed to communicate via signing and none of the staff were actually able to sign. So that's something to watch out for, make sure it's inclusive for everyone. We would also recommend making your activity as tangible as possible. So using show rather than tell. Physical props are brilliant. You've already seen our emoji cushions, very successful. We also had a glittery dice that people could throw, and it had different questions and prompts on each side. And we got people to make posters and collages. So anything hands-on works really well, and of course letting people keep what they create. And then during the session, again, it's about making it as rewarding as possible for everyone involved. So what we like to do is thank people with a person-centered incentive. So we try to think about what people would like as a thank you. We found that printed portrait photos were really popular. So we did that for a lot of participants. Certificates were very popular, particularly for people who'd been involved over a longer period of time. We really wanted to kind of recognise their contribution as co-designers, or it could be anything really. We interviewed one man who said it was his ambition to write a book about his life, and since he told us all about his life, we typed up a copy of everything he told us, and we kind of put it in chronological order and gave it to him and said maybe it could be a first draft of his book. So just trying to be thoughtful and thank people in an individualized way. And then another top tip, which is actually really easy, is just going to Poundland or Tiger and getting some nice materials. So magazines, little people figures you can get are great to make mini versions of yourself. Stickers, sparkly paper, glitter, anything like that is really, really good. And people actually really appreciate just being given new, nice materials and not kind of magazines being wheeled out that have got loads of things ripped out of them that have been used time and time again. And this is the last thing we wanted to share, was just a couple of tips for after your activity. So when you're looking at the results, it's always important to analyse and kind of triangulate the results with assistance. So you could, you know, correlate what you've heard with a family member or a staff member, just to kind of like get a different perspective on what you've heard. And that's really important. We've got a great example here of somebody who we asked to create a poster about their week and then use emoji stickers to tell us about their favourite parts of their week and their least favourite parts of the week. And they said that they worked in a charity shop, I think almost every day, and all the charity shop days had a happy sticker, and then one day said they went to the day service and it had an unhappy sticker. And then we just, you know, spoke to a staff member about that, and they told us actually this person came to the day centre every day and just one day a week they volunteered in the charity shop. So that gave us an insight into this person's aspirations, and actually, you know, we found out that actually what they would rather be doing would be volunteering at the charity shop more of the time. And lastly, just let people know what happens next, and use accessible ways of doing so. So you could provide a little video to let people know what happened and what they contributed to, or go back and visit, which we did in this project, or provide accessible written feedback. So that's all we wanted to share, but we'll be very happy to answer questions.
Thank you so much, Ali and Jenny. That was really, really good. I loved all the takeaways, and I especially remember the poo cushion. I think that's such a great idea.
So many takeaways. You asked for takeaways, and this is what happens.
I'm going to find a reason to use that if I can ever. Can I be cheeky and ask one question?
Go for it.
With accessibility, especially with learning disabilities, I was wondering, did you have to do anything from a research ops point of view, especially with NDAs and stuff, like to make it easy for them to understand what they were signing? Or how did you go about doing that?
We didn't have any NDAs in the project. In terms of kind of getting people to consent to participate, we kind of took participation as active, ongoing consent, and we explained to people at the beginning that if you want to stop at any time, you can, and people did take that very literally. Ali, do you want to say anything more about that?
No, we did create easy read consent forms to start with, but we soon learned that we could lose a whole session or half a session to trying to fill out consent forms, and they didn't actually mean any more than giving verbal consent, you know, to saying you don't have to join in. We did a lot of research around informed consent and people with learning disabilities. And yeah, as Jenny said, it was kind of making it clear that people didn't have to participate if they didn't want to. And it was, you know, as long as people were continuing to engage happily, and also listening to staff around people who knew people really well and taking that on board as well, that's how we judged it.
That's great. I'm going to hand over to Anya now.
Sure, I'm going for the specific ones for you guys first. So the first one we have is in regards to the activity box or toolbox that you mentioned. And Monica is wondering, how do you decide which activity to use, and do you decide the activities according to the group of participants? So maybe tell us a little bit more about that.
So we always planned what we were going to start with, what we were going to try. But when we say an activity box, it was literally, it was a huge bag on wheels that we took with us to every session. So even though we had planned, right, this is what we want, what we would normally plan is this is what we want to learn from this group that we're going to, and this is what we think is going to work based on what we've been told, because obviously we always engage with the staff beforehand and ask, you know, what are people's communication needs, what do people enjoy, so that we can get an idea of the group that we'll be working with. So we'll go with what we want to learn and how we think we're going to learn it, and then several other, well, a whole bag full of other options that we will then, you know, swap in and out as necessary.
Brilliant, thank you for that. We have another question from Michaela, our fabulous sketchnoter, who hopefully will share her things on Twitter afterwards. So first of all, a word of praise. So she really enjoyed you know, the work that you're doing, and especially the before, during, and after. So very insightful and practical. And she says that she sees a lot of comparison to the work by a couple of people. So Behaviour, who did work on cultural probes when working with older people, and then further work by Sustar with people with dementia. And she's wondering if you can be specific in terms of how the cultural probe method you have presented is greatly different.
Well, we love a cultural probe first and foremost, especially during lockdown. You can't even imagine how many things have been posted to people. Many things have been posted out. Yeah, I mean, it was actually a prototype rather than a cultural probe in this case, because what we wanted to test was whether people could take photographs of their day-to-day lives, and whether it would kind of have any meaning for somebody trying to interpret those photographs without any text or any explanation, because that was a feature of the digital diary that we had in mind. So we actually wanted to test whether it was viable for a local authority to understand anything about somebody's day-to-day experiences just from pictures and an emotion. So just a picture, and whether it was a good or a bad experience. Can you actually extrapolate something from that? Which we decided, yes, you could. So in this case, it's actually a prototype. Ali, do you want to expand on that at all?
No, I don't think so. You know, in that, like you said, in that instance, it wasn't, cultural probe wasn't its intention.
Great. I have actually kind of, I guess, 3 questions that I can put into one. They're by Cheryl, Chantal, and Beatrice. And it's a bit about the practical side of the project. So first of all, how did you identify the 6 key research areas at the beginning of the research? And then did you have to have the staff with the participants at all times? And how long did it actually take? I'm happy to remind you of the individual ones.
Well, how long did
too
it
much.
take? That was the last one, is easiest. It was about 6 months for the design process, and then we worked with the developer for another 4 or 5 months after that.
With regards to, did we have to have staff? Yes.
Yes, we always had the staff there, to help.
Especially to help, and because it's, you know, people need to feel comfortable. We were new people. So yes, the more hands, the better often, you know. And also, as we were saying, it's really helpful to have that view of what you're being told and what people who know individuals really well know, you know, it can tell you as well. So there, I mean, there were several examples of that in this project. So at one point, somebody was telling us through sign how much they'd been swimming that day, and how much that's the activity they'd done that day. And a member of staff very discreetly told us that actually that person had not been swimming that day because they weren't able to go swimming anymore. So again, it's that whole thing of, actually, if we didn't have people that knew individuals really well in the room, we wouldn't get that same nuance of understanding.
And then with the themes, we wanted to go quite broad. So we did look at people's experiences of government consultations, if they had experienced anything like that and what it was like. But we also looked at kind of what are people's day-to-day lives like? How do people communicate? How do people get information? How do people use technology? I think those were the main ones. It was really about going quite broad and getting a lot of contextual information.
And how much choice and control people had. That was another one.
Yeah, which is key if people are going to take part in things.
Brilliant. Thank you. So I now have like a couple of questions that are actually also relevant to Tim. So, you know, all of you can answer. So the first one was from somebody who had this question like right from the beginning, and they were wondering about whether you guys can recommend any books on the subject of inclusive user research, or blogs, or anybody to follow maybe as well. And if that's putting you too much on the spot, then maybe let's all have a think, and we can tweet about it afterwards.
We actually,
just if anything springs to mind.
Particularly around learning disabilities, we've looked extensively for information about how to do it, didn't we, Ali?
Yeah.
And I think we found one paper. We found one paper that had some good tips in it, but we really struggled to find any resources about inclusive research for people with learning disabilities. This was a few years ago, so there might be more up-to-date information now, but more generally we can have a think and we can share.
Yeah.
I'm glad you said that, because you know, my thinking in my mind, it comes short when I think of books. I maybe it's just my age, but books for me never strike me as interesting because they're kind of set in time and out of date immediately. I tend to do all my reading online or on blogs. The one, it's not really an author, but it's a body of work that comes from the UCL, University College London, always put out every year amazing UX, UI papers. And I tend to read upon what they're saying. I think, and University of Washington as well in Seattle do some amazing human machine interaction studies. Also, obviously, MIT papers and Stanford and Carnegie Mellon, all those places do some great papers. So I tend to read those more than books.
Yeah, I'm just reading a comment from Brian here, who has joined us tonight, and he also says academic world has lots of research for inclusive research. Christine is talking about OCAD in Toronto. So yeah, if you're reading anything that you find interesting, tweet it and tag us in your tweet, and we'll retweet for others as well. Great. So now a very practical question that I'm also super interested in. How do you recruit participants with access needs? Like, where do you go? What do you do? So maybe you can both share as well.
Ali, I think you've probably got a lot of suggestions around this.
So yeah, I mean, we use a mixture of approaches, because obviously going through existing services is one way, but that is only reaching people who use formal services. So that's one of the reasons we've been to so many club nights for people with learning disabilities, because they're a great place to go to meet people who aren't necessarily accessing formal services. So for us, a lot of that is around just finding out where people go, where people hang out, what's going on that isn't, you know, attending a day centre or those more formal things. Also, we've used sort of educational institutes, so colleges, a lot of colleges and schools have welcomed us. As I said, the only challenge we've experienced really has been around reaching people who have behaviour that can be seen as challenging. But yeah, beyond that, I mean, it does take a lot of reaching out, and I think a lot of often reassurance, which is another reason, you know, why it helps to have somebody with experience on your team, because if you can say, look, I'd love to come and spend some, you know, this is why we'd like to come and meet some people who are using your service. However, we really want, you know, we understand that you know the people that use your service best. We want to learn from you. We will lead by your example. We will listen to what you tell us about what activities would be happening at this time of day and what activities would work best, and being very open to being collaborative with the people who, you know, work with the people you're trying to reach every day. But yeah, it can be difficult. There are, you know, clearly the difference is, especially with people with learning disabilities, is that there are often gatekeepers. You can't directly, it's quite unusual to be able to directly contact the people that you want to work with. You often have to go through other people, which adds another barrier potentially.
Tim, do you have anything to add in regards to recruitment?
Yeah, a couple of things, kind of one interesting and one perhaps boring answer. I think the boring answer is to the point made earlier is I think there's a bit of an art in recruiting these users, and there's a skill set required that I think is beyond me. I don't think I would be the best of recruiters. I'd certainly contribute to briefs that we would give to an external recruitment agency. The great thing with that is that compliance and ethics and legalities and so on are covered. especially when you're working with vulnerable people or children. Children was very difficult to well, it was easy and it was difficult. Easy in that I know lots of people with children, so I could just recruit them. But actually, that would have been very naive and potentially problematic, because that, you know, ethical and legal hurdles need to be complied with, I should say, and that's just beyond my skill set. So we found it quite useful to use a external company. The less boring answer, though still quite mundane, is that for vision impaired people, as I said, I'm on the board of Wayfinder, which has, you know, a number of supporters and communities of people with a vision impairment, and we just use those people. So sometimes it's good when you get more and more experience and your network kind of increases, and you have more and more interesting and diverse people in your network, or you can actually rely on your network a lot more. And I think that's how I've done it in the past. But yeah, it can be, for me, I think it's an art form, and I think it can be very skillful to get the right people for the right type of testing.
Great. I can see that Sadaf also had a question around this in regards to collaborating with organizations that you're already in touch with. So, you know, that are in touch with the community. So I think either Ali or Jenny, you mentioned like schools, communities. I don't know if anybody else has experience with that. I'm looking a little bit at Rick, who I know is probably busy tweeting, but I think Rick, you also have experience with recruiting target groups like this, don't you?
Sorry,
yeah.
I was deep inside checking our Twitter notifications.
Sorry.
I do have finding and recruiting people with cognitive disabilities, particularly people with dementia. But I missed the very first bit because I was checking something in our notification stream.
Oh, it was just a question of how do you go about recruiting people with access needs?
Interesting. It's a perennial conundrum, and certainly listening to Humanist talk when I think it was Humanist talk when you were saying that beware service users or people in panels who perhaps are overused and who never change. That's certainly something that is a risk that I recognise at Alzheimer's Society. And so one of the main ways two main ways I try to get around this is to either, if budget exists, to use a professional recruiter to help find people who are representative or have compounded needs, so perhaps people with dementia or affected by dementia, and also an additional aspect of accessibility and inclusion. Or I try and recruit people directly, particularly through intercepts on our online services. We're quite fortunate that we have about 20,000 people a day coming to us for our online services. And so that can be a great way of finding people who are representative, although warm to us in some way.
Brilliant, thank you. I think we've come to the end of the questions and the end of the event. So I'm handing over to Sweta.
Hey everyone, I promise I will leave you all in 5 minutes, but thank you so much. That was really, really good. I really enjoyed all the talks myself, if I may say so. And I hope you enjoyed our Christmas gear, and we'll leave you with this image as we say goodbye to this very interesting and awkward year. I'm going to leave you with a couple of things. We have Michaela Lewis, who is one of the attendees today, and she is sketchnoting. So if you follow us, we will be retweeting her sketch notes. And she always does fabulous sketch notes, if I may say so. And I also wanted to say, I'm going to be quite ambitious in this, as Anya says. So we did part 1 of inclusive user research. We want to do a part 2 where we want to get the other side of ethnicities and geographies, like when should research include everyone from that point of view as well, and race and that kind of thing. So if you know anyone who would like to speak on this, and if you have interesting problems that have covered that topic where ethnicities and race and geographies matter, I would love to hear from you. We would love to hear from you. So just reach out to Anya and me at the research thing. And I think that was everything. Thanks again to all the speakers. Thanks to Rick and thanks to Chris from the UXPA UK, and thanks to Ben from Zebra People. Cool.
Thanks from us as well. Thanks for coming, everyone, and thanks for the
Thanks
great
very much.
questions.
Thanks,
everybody.
everyone.
Thank you.
Happy holidays. Bye.
Bye.
Bye.